Your provider has prescribed Revlimid, also known as lenalidomide, for you. Our pharmacy team has prepared a 7-minute presentation which will go through the important things to consider while taking this medication. Here is our table of contents. We'll start by going over general chemotherapy precautions, and then we will discuss concerns specific to the medication you'll be taking. What is oral chemotherapy? Oral chemotherapy is cancer treatment you take by mouth, in pills or liquid. It is just as strong as other types of chemotherapy, such as an injection. How do you handle oral chemotherapy medications? Keep chemotherapy away from pets or children. If a child, pet, or other family member accidentally takes your oral chemo, call the National Poison Control Center. Pregnant women should avoid handling chemotherapy or cleaning up after a person taking chemotherapy, including cleaning the bathroom and laundry. Wash your hands with soap and water before and after you take oral chemotherapy. Do not break, split, open, or crush the tablets or capsules, and keep these medications away from places where you handle food. How to store oral chemotherapy medications. Keep any oral chemotherapy medicine in its original container, separate from other medicines. That includes using a separate pill organizer for chemotherapy. Store your chemo at room temperature, away from heat, moisture, and direct sun, and ask your doctor or pharmacist if you should keep any medications in the refrigerator. And of course, if you do, keep them away from children. How to clean up oral chemotherapy medications and waste. Wear disposable gloves. This includes cleaning areas where body waste goes, such as the bathroom and doing laundry. Avoid touching your urine, vomit, or bowel movements while taking oral chemotherapy. If you get some on you, wash it off with soap and water. You can use the same toilet as other people who live with you. Ask your doctor or nurse if you should flush twice after using the toilet. Wash your hands with soap and water after using the toilet. Wash sweat off your skin. Wash your bed sheets, towels, and clothing separately from other laundry. If you have extra Revlimid tablets, they must be mailed back to Celgene. Call them and they will send you a mailer to mail the medication back for free. Do not put extra Revlimid tablets in the trash, sink, or toilet. What if oral chemotherapy does not work well? Make sure to take your oral chemotherapy exactly how your doctor or nurse tells you in order to give it the best chance of working. If the oral chemotherapy does not slow down or stop your cancer, your doctor will talk with you about other treatment options. If you feel you need to stop oral chemotherapy, be sure to call a doctor or nurse first. Oral chemotherapy can cause side effects just like other chemo can. We have some of the major side effects for all chemotherapies listed here, but there are many others that are possible. Call your nurse right away if you have any questions or concerns. Waiting even 1 to 2 days can be dangerous. The generic name for Revlimid is lenalidomide. Lenalidomide is an anti-cancer drug that is usually used for multiple myeloma, myelodysplastic syndrome, mantle cell lymphoma, and other indications that your doctor might feel is appropriate for you. Lenalidomide is typically taken as a pill by mouth. Do not crush, chew, or dissolve the tablets. There are strict guidelines that you must follow to receive lenalidomide. We'll help you at the pharmacy to make sure you fill out all the necessary paperwork. Your doctor will determine your exact dosage and schedule, and doses may be adjusted based on your blood count results. If you miss a dose, skip the missed dose and go back to your normal time. Do not take 2 doses at the same time or extra doses. Side effects of lenalidomide. The important thing to remember about the side effects of lenalidomide is most people will not experience all of the side effects. Side effects are often predictable in terms of their onset, duration, and severity, and side effects will usually improve after therapy is complete. Lenalidomide side effects may be quite manageable. There are many options to minimize or prevent the side effects of lenalidomide. The most common side effects are low blood counts, such as low white blood cell counts and platelets. Other side effects include diarrhea, itching, rash, and fatigue or tiredness. Less common side effects are listed here. Contact your healthcare provider immediately, day or night, if you experience a fever of greater than 100.4 Fahrenheit or 38 degrees Celsius or higher, or chills, which are possible signs of infection. Also, if you experience sudden chest pain and shortness of breath. Contact your healthcare provider within 24 hours of noticing any of the following: unusual bleeding or bruising, black or tarry stools or blood in your stools, blood in your urine, diarrhea greater than 4 to 6 episodes in a 24-hour period, nausea which interferes with your ability to eat and is unrelieved with prescribed medication, extreme fatigue, leg or arm swelling, redness, pain, and or warm to touch, which could be signs of a blood clot. Before starting lenalidomide treatment, make sure to tell your doctor about any other medications you're taking, including prescriptions, over-the-counter medications, vitamins, and herbal remedies. Do not take aspirin products unless your doctor tells you it's okay. Do not receive any immunizations or vaccines without your doctor's approval. Lenalidomide is extremely dangerous to take while pregnant. If, while taking lenalidomide, you become pregnant, be sure to let your doctor or nurse know immediately. Males must use a latex condom during any sexual contact with women of childbearing age. Risk to the fetus from the semen of male patients is unknown, but it could be very dangerous. Do not breastfeed while taking lenalidomide. Drink about 8 to 10 glasses of water a day while taking this medication, unless you're instructed otherwise. You may be at risk for infection, so try to avoid large crowds or people with colds and report fever or any signs of infection immediately to your doctor. Wash your hands often. To help treat and prevent mouth sores, use a soft toothbrush and an electric razor. Avoid contact sports or activity that could cause injury. To reduce nausea, take anti-nausea medications as prescribed and eat small, frequent meals. Avoid sun exposure. Wear SPF 15 or higher sunblock and protective clothing. In general, drinking alcoholic beverage should be kept to a minimum or avoided completely. You should discuss this with your doctor. Get plenty of rest and maintain good nutrition. You will be checked regularly by your doctor while you are taking lenalidomide to monitor side effects and check your response to therapy. Periodic blood work will be obtained to monitor your blood cell counts as well as the function of your other organs. For females of childbearing potential, a negative pregnancy test may be required monthly before the next month's prescription for lenalidomide. That's all we have for you. Be sure to stop by the pharmacy if you have any questions. Thank you.